1. What is the primary role of a Certified Dermatology Technician, CDT? A. Assisting in dermatologic procedures and patient care. B. Prescribing medications for skin disorders. C. Performing independent surgical interventions. D. Diagnosing complex dermatologic conditions. 2. Which skin layer contains melanocytes responsible for pigmentation? A. Stratum corneum. B. Dermis. C. Stratum basale. D. Subcutaneous layer. 3. Which of the following is considered a non-invasive dermatologic procedure? A. Punch biopsy. E. Cryotherapy. C. Mohs surgery. D. Electrosurgery. 4. Which diagnostic tool is most commonly used for examining suspicious pigmented lesions? A. Wood's lamp. B. Dermatoscope. C. CT scan. 5. The Fitzpatrick skin type classification system is primarily used to A. Assess hydration levels of the skin. B. Predict risk of skin cancer. C. Evaluate response to UV exposure. D. Diagnose autoimmune skin disorders. 6. Which instrument is typically used for a shave biopsy? A. Scalpel. B. Razor blade or flexible blade. C. Punch tool. D. Curette. 7. In dermatology, cryotherapy commonly uses which substance for lesion removal? A. Carbon dioxide. B. Nitrous oxide. C. Liquid nitrogen. D. Hydrogen peroxide. 8. What is the primary purpose of patch testing? A. Detect bacterial infections. B. Identify allergic contact dermatitis. C. Diagnose fungal infections. 9. Which type of skin cancer is most strongly linked to cumulative sun exposure? A. Basal cell carcinoma. E. Squamous cell carcinoma. C. Melanoma. D. Kaposi sarcoma. 10. Which procedure involves the systematic removal and microscopic examination of skin cancer margins until clear? A. Cryotherapy. B. Mohs surgery. C. Excisional biopsy. D. Laser ablation. 11. What is the most common site for melanoma in men? A. Scalp. B. Back. C. Chest. D. Hands. 12. Which topical agent is frequently used to treat acne vulgaris due to its keratolytic and antimicrobial properties? A. Hydrocortisone. B. Benzoyl peroxide. C. Tacrolimus. D. Ketoconazole. 13. Which skin condition is characterized by silvery white scales and erythematous plaques? A. Eczema. B. Psoriasis. C. Rosacea. D. Tinea corporis. 14. The ABCDE rule is used in dermatology to evaluate A. Fungal nail infections. B. Suspicious moles for melanoma. C. Allergic skin reactions. D. Vitiligo progression. 15. Which microscopic preparation is most often used to confirm fungal skin infections? A. Gram stain. B. Potassium hydroxide, KOH, PrEP. C. Wright stain. D. Acid-fast stain. 16. What is the function of sebaceous glands? A. Produce sweat for thermoregulation. B. Secrete sebum to lubricate skin and hair. C. Provide pigmentation to skin. D. Form keratinized structures. 17. Which type of biopsy removes a cylindrical core of tissue? A. Punch biopsy. B. Shave biopsy. C. Excisional biopsy. D. Incisional biopsy. 18. Which dermatologic laser is most commonly used for hair removal? A. CO2 laser. B. ND-YAG laser. C. Pulsed dye laser. D. Excimer laser. 19. What is the primary risk factor for actinic keratosis? A. Viral infection. B. Chronic UV exposure. C. Autoimmune disease. D. Genetic predisposition. 20. Which type of psoriasis is considered a medical emergency due to systemic involvement? A. Plaque psoriasis. B. Guttate psoriasis. C. Pustular psoriasis. D. Erythrodermic psoriasis. 21. Which dermatologic condition is often associated with a butterfly rash on the face? A. Systemic lupus erythematosus. B. Contact dermatitis. C. Psoriasis. D. Tinea versicolor. 22. Which of the following best describes vitiligo? A. Autoimmune destruction of melanocytes. E. Overgrowth of sebaceous glands. C. Chronic fungal infection. D. Allergic hypersensitivity reaction. 23. Which skin lesion is described as a fluid-filled blister larger than 1 centimeter? A. Papule. B. Vesicle. C. Bulla. D. Pustule. 24. Which is the first-line treatment for atopic dermatitis in most cases? A. Oral corticosteroids. B. Topical corticosteroids. C. Oral antibiotics. D. Topical antifungals. 25. Which of the following describes telangiectasia? A. Pigmented macule with irregular borders. B. Dilated superficial blood vessels. C. Thickened keratinized lesion. D. Inflamed pustular eruption. 26. Which dermatologic condition is strongly associated with the human papillomavirus, HPV? A. Warts. B. Psoriasis. C. Rosacea. D. Seborrheic dermatitis. 27. What is the hallmark of impetigo? A. Thickened silver scales. B. Honey-colored crusted lesions. C. Painful vesicles in clusters. D. Ring-shaped scaly patches. 28. Which term describes a small, solid, elevated lesion less than 1 centimeter in diameter? A. Nodule. E. Papule. C. Vesicle. D. Plaque. 29. What is the most common bacterial cause of cellulitis? A. Escherichia coli. B. Staphylococcus aureus. C. Streptococcus pyogenes. D. Pseudomonas aeruginosa. 30. Which skin disorder is characterized by flushing, telangiectasias, and papulopustules on the central face? A. Acne vulgaris. B. Rosacea. C. Psoriasis. D. Eczema. 31. Which dermatologic condition is known for hypopigmented, scaly patches commonly seen in children? A. Pityriasis alba. B. Vitiligo. C. Tinea versicolor. D. Psoriasis. 32. What is the main advantage of dermoscopy in dermatology practice? A. Eliminates need for biopsy. B. Enhances visualization of pigmented skin lesions. C. Detects fungal organisms directly. D. Identifies bacterial growth. 33. Which systemic medication is most commonly used for severe nodular cystic acne? A. Isotretinoin. B. Doxycycline. C. Clindamycin. D. Metronidazole. 34. Which diagnostic test is used to confirm herpes simplex virus skin infection? A. Zinc smear. B. KOH preparation. C. Gram stain. D. Patch test. 35. Which condition is characterized by multiple café au lait spots? A. Neurofibromatosis. E. Psoriasis. C. Tinea corporis. D. Rosacea. 36. Which type of alopecia is autoimmune in origin and presents as round, smooth, bald patches? A. Androgenetic alopecia. B. Alopecia areata. C. Telogen effluvium. D. Traction alopecia. 37. Which treatment is first line for localized vitiligo? A. Topical corticosteroids. B. Oral antibiotics. C. Antifungal creams. D. Laser therapy. 38. Which dermatologic emergency involves widespread blistering and epidermal detachment? A. Erythema multiforme minor. B. Stevens-Johnson syndrome. C. Seborrheic dermatitis. D. Tinea capitis. 39. Which of the following skin conditions is classified as premalignant? A. Seborrheic keratosis. B. Actinic keratosis. C. Cherry angioma. D. Epidermoid cyst. 40. Which topical medication is commonly prescribed for fungal skin infections? A. Acyclovir. B. Clotrimazole. C. Hydrocortisone. D. Salicylic acid.